Thank you. Welcome, everybody. My name is Dele Ogunsheto. I'm a professor of population health and disease prevention at UC Irvine. I also hold the UC presidential chair, and it is a deep privilege and honor for me to host this series that focuses on interprofessional research, education, and practice to improve the quality of life for people in our communities and our planet. We are honored to have distinguished speakers who have contributed their time, effort, energy, and all resources to very important topics. And I'd like to take this opportunity to also acknowledge the support of my department, Population Health and Disease Prevention, in the program in public health at UC Irvine. We are a strong community that has responded to various challenges, and equity is one of them. In the wake of a pandemic that's relentless, we continue to push the boundaries of research and public service. So I am really delighted to welcome our speaker today, Katie Kalvoda. I met her through the convening of the Orange County Health Improvement Partnerships through her work with the county healthcare agency and relevant stakeholders to really develop a quantitative framework for health equity. Many of you are very interested in this topic and you'll have questions. We have a Q&A box for you to type in your questions as we hear Katie. We will hopefully have some time at the end also for reflection and questions. If you have a burning question, just let us know. We have moderators who will be able to highlight you and unmute you. But we are making this a webinar to make sure that we all get the benefit of hearing with no interruptions. Katie is currently president of Advance OC. I have the website address on this page for you to explore their work. It's really exciting. It is a nonprofit organization based in Orange County here in California. She really had a successful career in investment management and then shifted her expertise in data science to solve some of the most challenging social issues of our time. Understanding that data is destiny, Katie sought to give visibility to marginalized and vulnerable communities by spotlighting inequity. Along with her work at Advance OC, she's a board member of many prestigious organizations, the Mission Hospital Foundation, and board member and finance chair for the Sisters of St. Joseph, among other accomplishments. Without further ado, please help me welcome Katie to our virtual campus and to our community. Thank you, Katie.
Thank you so much for that warm welcome. It's my honor and privilege to be here. Though I'm not an alum of UCI, this is the university in our backyard, and so I hold it in high regard. And I welcome everyone who's taken time on a Friday afternoon to talk about health equity. So with that, I will just go ahead and start telling the story about Advance OC and the work that we're doing around health equity and showing some examples, particularly with regards to the pandemic that we experienced in the last 2 years and how we are using data science in that regard. And then allude to some additional projects that we're working on and some partnerships that are on the horizon for us here. So with that, I'll just go ahead and share my screen and get into it. So I hope that everyone can see my screen. It's our standard PowerPoint presentation that we're going to be walking you through. So Advance OC, as mentioned, is a nonprofit. It's a public charity that's based here in Orange County, California. It was started relatively not too long ago out of the observation that there are things in our society today, in our community, that there are gaps between the haves and the have-nots in Orange County that seem to be growing over time, right? And me and some friends were witnessing that and just sort of asking ourselves, who is responsible for addressing equity in Orange County? And not having sort of a finite solution or a source for that, we decided that there was something that we could probably add to the conversation. And so that was in the form of data, and in the form of data that would be relevant, would be local, and would be actionable. So as I tell you the story of Advance OC and our work, you'll remember that the genesis of Advance OC is really to figure out a way to systemically challenge the structure, the built environment, and the way things are, because they're leading us to a path of more and more inequity. And as I will share at the end of this presentation, I have an ask for all of you that you join me in this journey of equity and give you some perspective of how you can help. So as a nonprofit, of course, we have our theory of change, and we ask a simple question. It's really a question of the science of where, right? What would you do if you knew where suffering lives, where poverty persists and dreams are denied? I think in some form or fashion, we all know anecdotally where that is in Orange County, but not knowing exactly sort of the root causes some of these, of the suffering and this poverty that's persistent, we may not be able to derive at an adequate answer. And so our goal as an organization is to derive at those root causes by using quantitative and qualitative data, and then engaging community stakeholders in a conversation about those root causes. So our organization, because it's fairly new, it's also fairly small. We have a 5-member board of directors. Myself, Nazi, and Sister Twee are founders of Advance OC, and we've brought on 2 additional board members as well. As you can see, we all have deep roots and ties in Orange County. We've volunteered in a variety of different ways, and collectively have observed the same thing, which is the growing inequity in Orange County. And that's really the story that I'm going to tell today, which is a story of 2 horizons in Orange County. We live in one of the most beautiful places in the world, quite frankly. And even though that we see sort of, this is one of the highest visited areas in the country and probably in the world as well, with Disneyland in our background, it is a tale of 2 horizons. We have growing inequity in our community, challenges around housing, around health, around education, the economy, and such. And so if you think about these challenges and this growing inequity, we have to ask ourselves, how do we close these gaps? So at Advance OC, we aim to address these disparities by bringing community stakeholders together, but also creating a baseline. As students of public health and folks that are aspiring to be professionals in the medical field in some form or fashion, you probably know firsthand that, you'd have to go visit your doctor and create a baseline. How are you doing health-wise? And that's exactly what we're doing for the County of Orange, is we're taking a temperature and creating a baseline for the health and wellness of our residents here in Orange County. And we're doing that through a social progress index. And the index itself is comprised of over 50 different indicators, and I'll go into that in a little bit, but it is meant to be able to track, map those root causes, those social determinants at the neighborhood level. So as we're thinking about health and wellness of a patient, let's say, we need to think about the health and wellness of a community and diagnose the neighborhoods in which they live. So in order to do this, we sought out to partner with sort of the gold standard of social progress indexing, and that is the Social Progress Imperative. They are also a public charity based in Washington, D.C., and the Social Progress Index is the brainchild of scientists and social scientists at Harvard and MIT and the World Economic Forum and the Rockefeller Foundation and so many, many more thought leaders in the space. They measure the Social Progress Index for all the countries in the world, creating a global Social Progress Index. But they also measure the Social Progress Index for a variety of different countries, including the European Union, the country of Australia, Costa Rica, etc. I've been watching the Australian Open recently, and the country of Australia themselves have a national social progress index. And so it's really something that we wanted to do is to bring the best of the best, the gold standard of this indexing work and their methodology to Orange County. And so we partnered with them to build a very customized social progress index using the same methodology as the one that is embedded in the global index, but using localized data here in Orange County. And this is what the Social Progress Index is made of. It's 3 dimensions of data: basic human needs, foundations of well-being, and opportunity. And underneath each of those dimensions are 4 categories, or we call components, that make up the determinants of those dimensions. So you'll see that we're tracking everything from water and sanitation to housing to personal safety, and then to access to information. Where is the digital divide in Orange County, right? Things like poor mental health, obesity, and diabetes prevalence, as well as environmental quality at the neighborhood level, which is somewhat tricky to do. And then things also like childcare deserts. Where do we have gender pay gaps? And notions of inclusiveness, which also identifies those communities or those neighborhoods in Orange County that may be linguistically isolated or residentially segregated. So these are the components that were derived by a series of principal component analysis. And that statistical analysis allows us to be able to fine tune and be able to adopt these 55 indicators. As you do your research in the world of social science, for example, or even in health science, you'll see that there are thousands of different indicators that are available to speak to the social vulnerabilities of a community. But what we attempted to do here is to be able to funnel a lot of those indicators through the process of principal component analysis and be able to derive at a smaller subset of those indicators. So how did we go about doing this, and how on earth were we going to get a wide adoption from the community, right? So we started with a steering committee, and we asked a number of different organizations from across different sectors in Orange County to join us in this effort. We created this task force comprised of about 15 different organizations here in Orange County, some of whom are listed here on this list. But there were many, many more. We had up to 40 different super users, as we call them, who spent over 3 months validating and testing the data in our index. So as you can see, we had a host of partners in the public sector. We had educational partners, health partners, and philanthropic partners. And then when we launched this event through the partnership with the healthcare agency and the County Board of Supervisors, with Chairman Andrew Doe and Vice Chair Doug Chafee, we launched the event on July 14th of last year, and since then have been giving a number of different presentations, very similar to this one, all across Orange County with a variety of different community-based partners. And the reason for that is because we obviously want to build awareness, but also to have that feedback loop, understand what and responsive needs with this tool. So with all that said, this is a screenshot of the Orange County Equity Map, as we call it. And as you can see, it's a private-public partnership between us and the Orange County Healthcare Agency with support from the County Board of Supervisors. And it being called the Orange County Equity Map, we wanted to make sure that we addressed visually and in a very compelling way, the concept of equity, or in this case, inequity. So when you tally up sort of the index scores of all 580 census tracts here in Orange County, you see that it's visualized here on this map with yellow areas or yellow communities that are colored yellow on this map as having low scores of social progress. And then the deep purple and the dark blue are areas of high social progress in Orange County. And automatically you would see that there is a bifurcation between North County and South County. And then you also see in the areas right here that I'm circling are areas containing our communities of color. So we know that there is inherent inequity in the built system that we have here in Orange County, but we also know that there's a strong element of racial inequity as well. So with all of that information data, of course, you can aggregate it up to the county level. And so here are some of the average component scores. You'll notice here that the US SPI score is about 85. This is compared to a lot, 163 different countries in the world. In that respect, we have a lot more resources and are further developed in some areas such as education or higher education than other countries. But this is the score for all the components within Orange County. So you'll see that overall our social progress score is 44.53, and then it goes, it varies according to the various different component levels. And then with that, we also have the ability to score the cities. So with the social progress index and the 55 indicators, you'll see that we have a score of between 55 for Aliso Viejo and Mission Viejo in the city, in those cities, and then all the way down to Santa Ana with a score of 31. And once again, what we see is sort of a bifurcation of those cities that are above 50 and those cities that are below 50 or 50 and below. And then once again, if you look at the third column here, those are also many of our cities that have diverse populations or communities of color as well. So when you collect the data at the census tract level, what we call the neighborhood level, you can know the performance of, or the SPI score of those individual census tracts. So here we're showing you the top 50 census tracts in Orange County. And then of course, we know the bottom 50 census tracts as well as all the 480 census tracts in between. And what happens is that when we aggregate all of this data, residents are given a scorecard for their neighborhood that looks something like this. And so you'll see that this is a neighborhood in La Habra and Fullerton. The census tract number is 17.07. And you'll see the 3 dimensions of data as well as the subcomponents that make up those dimensions. The first column of this scorecard is the raw score for those various different indicators. And the second column of data is the overall rank or the relative rank out of 580 census tracts. You'll know whether or not this particular neighborhood's in the top quartile or bottom quartile based on the ranking. And then you'll also see yellow dots, red dots, and blue dots. We call them sort of our modified traffic signals. And what you'll see is that we actually create a peer group for every single neighborhood in Orange County. And you'll see that based on similar median household incomes and the performance that they have on the social progress index, they are either scored a yellow dot, which means they're performing as expected. A red dot means that they're scoring below their peer group. And then the blue dot tells you that they're scoring above their peer group. And since this is a presentation I'm doing at a university, I will tell you that the hollow blue, the solid red and the solid blue would be a 1 standard deviation below sort of the hollow blue and the hollow yellow, the hollow red. And so how would one interpret this data? So as an Orange County resident, the social progress index score for your neighborhood will give you access to information how you're doing across multiple measures of well-being and health. It will allow you a tool to go and speak to your local representatives to improve the conditions for you and your neighbors. As a local elected official and policymaker, this index scorecard will allow you to understand where the greatest needs are in your community so that you can create a participatory budgeting process to allocate funds and resources and attention to those greatest needs represented by the data set. And then, of course, as an educator, a healthcare provider, or a philanthropist, you can direct resources and also be able to create interventions that may or may not fall within the clinical setting. You may refer certain clients to social services, for example, if there's a high need in that area. So it allows us to see a person holistically, not just the biometric data that you may have in front of you, or the sort of the performance at school for a student, let's say, but you can see the conditions of their neighborhood as well. And on our website, you'll see that we have an option for anyone here in Orange County to type in their address. And so if you go to advanceoc.com and look under Social Progress Index, midway through the index, you'll see this neighborhood lookup or address lookup bar. And you just basically type in your address. You'll also notice that we have it in English and in 5 other languages as well, because we want to make sure that it's accessible to everyone. So then you find your address, and then it'll identify your census tract, right? And then give you a summary scorecard as well as the scorecard itself. So it'll give you sort of a summary of the highest component scores and the lowest component scores, and then you can see the scorecard for yourself. So this tool is actually meant to be empowering communities at the grassroots level, as well as a tool that can help policymakers at the very top. Right. And so again, you click on see scorecard, and this is the scorecard you would see. It's dynamic. So in the future, when we change the data as a result of the updates that we'll do to the index, this will automatically be updated as well. So it'll always reflect the freshest set of data that we have. So let's go back to talking about the data and talking about health equity. So again, I'll remind you that this is the screenshot of the map of the Orange County Equity Map with the Social Progress Index scores. And when we overlaid COVID cases on top of this, you can see there's a stark relationship between the two. So areas that we saw high numbers of COVID cases are also areas where we saw low social progress scores. And this is data that's as of January 20th of this year, 2022. So we update this data on our dashboard so that the public can be informed of this information, but we also keep track of this through a partnership with the healthcare agency. So what does this all mean about health equity and managing things like COVID, which has wreaked havoc all over our county for the past 2 years and ongoing? What we're able to do in this exercise in real time with the healthcare agency is we're able to take a look at the data sources and be able to compute a composite index that looks like this. And we call this the Orange County COVID Vulnerability Map. And we were able to take data at the neighborhood level, pinpointing health and comorbidity risk factors identified by the CDC as having a contributing factor to severe hospitalization and other complications and perhaps even death when patients are infected with COVID, as well as the Social Progress Index, social vulnerabilities metrics that we have in our SPI. And when you combine the two, you can then create a risk profile that would accurately reflect who in our community should be most vulnerable to COVID. And when you have scarce resources, like we did in the beginning days of the vaccine, you can direct those resources to the communities that need it the most. And in effect, you can target those communities so that you can reduce the risk of exposure across the board. And by doing that, and that's exactly what the healthcare agency did with limited vaccines at the time, we were able to send mobile vaccine pods to those communities that needed it the most because of their vulnerability to COVID, as well as making them widely available at superpods as well. So ultimately, when we talk about equity, we have to be able to analyze equity at a neighborhood level. And this is a dashboard that we also created to show what equity and or disparities look like. So what we've done here is we've taken the 3 dimensions of the index, and we've taken the components of those dimensions, and we basically lined up every single census tract or every single neighborhood in Orange County along that that horizontal line, with sort of the left-hand side being sort of those communities that score the lowest in that category, and the right-hand side are the communities that score the highest in that component. And when you see that it is wide, like in housing, for example, you have the lowest performing census tract in Anaheim and the highest performing census tract in Huntington Beach. When you line it up like that and you see how wide the dispersion is, that is a recognition of disparity in that particular component. But when they are tighter, like it is in nutrition and basic medical care, you'll see that overall, people people have access to about the same level of service in that category. And what we're trying to do is we're trying to promote not only closing the disparities that you see on the grid in these components, but we're also promoting sort of moving the average forward, right? So that we're not just closing it and bringing high performing neighborhoods down, by virtue of raising the low performing census tract. What we're actually trying to do is shift the whole axis over to the right. And so in doing that, you can understand how it takes everyone, every member of the community to be able to come together with public interventions and solutions to make this happen. So I want to spend some time talking about social progress and median household income. When we talk about this index and we talk about it to various different folks, they will say, well, it's pretty simple because, communities that have a lot of money will tend to have, discretionary income to invest in things that will promote social progress. And communities that have less money won't be able to do that. And to some certain extent, we know that income and is a social determinant, and it has a very a direct correlation to things like social progress, but it's not the entire, it doesn't tell the entire story. So what you'll see, for example, in the blue dots that I've circled are two communities, one in Santa Ana and the other one is a census tract in Mission Viejo, San Juan Capistrano, and Laguna Niguel. And they're relatively same median household income, but different social progress scores, right? And then if you look at the red circles, you'll see that they have achieved the relatively the same social progress score, but at different levels of income, median household income. So what we want to do is understand those high performing cities in every particular income bracket and understand what are they doing well so that we can replicate those things. And the areas that are more challenging, we want to understand how can we help support them in those areas so that they can achieve greater progress as well. And then we took something like that, which is, of course, as you probably all recognize, a regression analysis. And we made it a little bit more accessible to everyone in Orange County. So we created this dashboard. It's called Correlation Analysis by Neighborhood. And it's basically exactly the same concept as what you just saw that we did in a statistical program, right? But instead of doing a correlation coefficient on this, which is what you would see in a typical statistical package, we did quadrants. So we took the median value for X and Y, and we divided up the map into 4 quadrants. And we can basically tell folks in the community that this is the quadrant you'd want to be in because you're achieving high levels of social progress with low median household income, right? So these would be the subjects, so to speak, as to what we would try to emulate, right? And then similarly, those folks that are scoring low in this quadrant, for example, low social progress, but have high median household incomes, we have to investigate that as well to see, are there missed opportunities that we can capitalize on. And so what we're doing here is not only are we doing it by the x-axis and y-axis variables, right? So social progress against median household income, but we overlaid COVID cases on top of that. And that's the color, the side dots, the side number of COVID cases, as well as the color will tell you the number of COVID cases as well in terms of intensity. So What I want to talk about is examples of other use cases that data science can contribute to, equity across the board, not just health equity. Of course, I've shown you the COVID vulnerability index and the social determinants of health conversation. Actually, I'm so sorry, I skipped around quite a bit. So let me just go back to this slide. What we're talking about today is a conversation that we were presented at the National Health Equity Summit with the Orange County Healthcare Agency. You see Dr. Chow there and two of his colleagues, Hugh Nguyen and Karen Kalk, who worked really closely with us during the pandemic to use our data to help mobilize a vaccine response. And so in very similar format, we talked about what we were doing to a national audience. And so what we really zeroed in on in that conversation was the idea of how does health equity or inequity manifest itself? And what we know is that it's going to manifest in things like life expectancy, right? So we have our equity map here where we've screened down to the city of Anaheim. And what you see is where Disneyland is, and across the street from Disneyland, we have a life expectancy of 75 years for those residents. And then down the street from Disneyland, we have a life expectancy of 89 years. So with that, you see visually here and also quantitatively that there are these disparities in health and in chronic conditions that ultimately lead to shorter life expectancy for people that live within a couple miles of each other. And as students of public health, you know and understand why social determinants of health matter. And just for simplicity's sake, we put this slide in to talk about how only 20% of your health outcome is determined by access to care and quality of care. So those are things in a clinical setting. And then we have 80% of your health outcome is based on other factors. And so healthy behaviors, the physical environment, and socioeconomic factors, which are the things that we are trying to capture in our social progress index and the equity map. And so one could also say that healthy behaviors is a function of physical environment and neighborhood and environmental factors as well. And those are things that play an overwhelmingly larger part in determining, again, life expectancy and chronic conditions, trends in chronic conditions. And so as I showed you earlier, we had the social progress index and the COVID overlay. And so what I wanted to then now talk about is sort of the other examples of use cases. We are currently investigating and doing a map on food insecurity in Orange County. And we're using data from county agencies and also different community-based organizations to identify what makes someone food insecure, and then matching that up with solutions that promote long-term nutrition, right? So that the next pandemic or the next recession or the next major huge event that happens in our community, we're not back to square one, right? With sort of the same people without access to food and without access to basic needs. And then on the flip side, we're using data science as well to do community development work. We're tackling things like housing and homelessness, opportunity zone development, and even ARPA, which is the American Rescue Plan Act. So one of the ways in which we would like to grow our data science capabilities to help close the gaps, the social and health gaps in Orange County, is to build a youth vulnerability index. And this is something that's definitely an area of passion for us because we know that children have been so impacted during the pandemic. And we're starting to collect a lot of that data to do trends analysis. And so this is the right time for us to develop something like this and be able to tie it to things like education outcomes and even things like mental health screenings, like suicide ideations and attempts and such. So we're working really closely with partners in the community to do this, as well as doing sort of a vulnerability measure that will help identify potentially who could be at greater risk, right, of various different conditions, including mental health conditions. So I wanted to spend a little bit of time talking about the actual data science piece of it and artificial intelligence. We recognize and understand that data science is a stepping stone to what we think we are seeing in the field of medicine, which is very much personalized medicine, right? And personalized solutions that tie to your own biometric data and being able to capture the social determinants in the zip code or in the census tract in which you live. And so how they do that is that, you're starting to see medical devices like, maybe the Apple Watch that senses your sleeping habits or your exercise habits, to the Oura Ring that's capturing that from your finger. But imagine if you had, a mirror in your house that uses radio waves, for example, that can detect whether or not someone has fallen. And this is particularly useful for our senior community, right? And those of us who have elderly parents, to have that peace of mind, knowing that there would be something there that would capture that kind of data. So being able to anticipate taking in this biometric data and being able to run these machine learning algorithms and deep learning processes to be able to create the intelligence that allows, a one-dimensional object like a mirror to be able to detect someone falling in their home is where the industry is headed. And for us, we're using it with all of the data that we have in social determinants. We're now starting to partner with different organizations, including hospitals, marrying the social and environmental factors that we have with clinical data. And one example of that I'll go into, but I'll talk about this one interesting slide, which is sort of a picture of chihuahuas and blueberry muffins. I have a chihuahua, so I'm quite biased on this. But essentially, with your human eye, you can tell the difference between which one is a chihuahua and which one is a blueberry muffin, right? But the idea is that if you feed this to a machine, enough different variations of these types of photos, ultimately the machine will be smart enough to understand when it sees a chihuahua and when it sees a blueberry muffin. And this is happening today. This is happening with X-rays. This is happening with MRIs and things like that. And so we get to a point where a machine can detect certain abnormal features before maybe the human can, right? And so if you incorporate that with other intelligence, you could find yourself in a situation where we capture a lot more early screenings of cancer and other things, and be able to save more lives in that way. And so deep learning is the sense of taking the machine learning that is as simple as feeding these X-rays or these images through a machine and having them learn it, and then being able to take historical data, other algorithms, other data sets, and being able to make sense out of it, right? So what I just showed you today is sort of understanding the business need for data science in the field of medicine and health. We did a lot of data mining in creating the Social Progress Index. We cleaned a lot of the data because, as you know, the CDC has a ton of data, the US Census Bureau has a ton of data. Being able to aggregate all of that, standardize, normalize that is the reason why it doesn't happen a lot of times in government, and it doesn't happen a lot of times in nonprofit organizations, is because it's a heavy lift. And so we've taken on sort of that burden for a lot of folks, and we're able to present data capabilities to them at a fraction of the cost, really, really quickly, because we've been able to adopt a methodology that can do that. And so what I showed you earlier with the COVID data and the social determinants of data, et cetera, is data exploration. And so we are only halfway through the life cycle of data science and what we can basically do with our capabilities. What's next is this idea called feature engineering, which is basically deep learning. What I talked about earlier, taking the images of chihuahuas and blueberry muffins, and not only being able to identify the differences between them, but then also taking in additional data sets and learning and teaching itself sort of how to tell the difference and improve its accuracy. And if you take a combination of social determinants data as well as clinical data, you can then begin to understand, is something predictive, is something a strong indicator of the other. And we're doing that right now in 2 different projects. One with chalk, as a matter of fact, to identify emerging risks in pediatric patients. So if we take clinical data and the social determinants of data and be able to marry the two and be able to figure out a relationship between them, that is called feature engineering. And then with feature engineering, you can create predictive models that'll identify risk exposure or vulnerabilities that we may not have known before, right? And the linchpin to all of this is to do the data visualization so that you can communicate that with patients, you can communicate that with parents, we can communicate that with the public in general, not so much as presenting the correlation coefficient, because a lot of times people could just look at that and it goes over their heads, but being able to figure out a way to improve health literacy because you're able to visualize the data in a helpful way, right? A way that is accessible to everyone in the community, not just folks that may have majored in statistics. And so some of the feedback that we've gotten on our prospects and our work has been across the board very positive. We presented again at the National Health Equity Summit, and we've done, we've presented this at, data conferences as well, including the American Health Information Management Association on social determinants of health. And we're partnering with a number of organizations, national and local, to investigate further ways to use data science to help achieve health equity. But when we talk about health equity, I also want to remind you that it doesn't start and stop with health equity. The journey of equity is all encompassing, right? We just had a conversation with someone yesterday who asked us if we could help them do social determinants of justice. Let's think about that for a minute, right? There's going to be a lot of overlapping determinants in both social determinants of health and of justice. But what we're trying to assess, and we're trying to understand the why in each of those situations are different, but they are profound. So I'll leave you with a story. And the story is that I had the pleasure of being able to take a short little vacation before Omicron became so prevalent in the community. And we were in the airport. You probably all have seen the conveyor belts, the people movers, where you stand on it, and one side it says, folks that walk, and then on the other side it says people to stand. And so for a lot of us, over the course of our lives, we've been on that conveyor belt, and we've been we've been on the walk side. We've walking through life, sort of not really appreciating some of the systemic inequities that exist, right? The structure of the conveyor belt itself. Why is it going in that direction? Who are the people that have access to that conveyor belt, and who doesn't have access to that conveyor belt? So I hope that through this conversation and other conversations or other current events that have happened since George Floyd and other things, that maybe you take a step to the left where you're standing and observing and figuring out why things are the way they are, why certain communities are persistently impoverished, why the criminal justice system has a bias towards communities of color. Why do we have certain communities that are heavy and frontline workers, and that had the first wave of COVID here in Orange County? So let's ask ourselves, could we move over and stand and take a look at our surroundings and challenge the status quo, and maybe even after that we turn around and we walk the other way, right? And when we walk the other way, we have realized and recognized that inequity exists. And when we do that, of course, we're going to run into people, right, that want to just keep going forward. But we have to step aside, look at our surroundings, turn around and challenge the status quo, because if we do nothing, the system of a systemic inequity will continue. And I hope that with this, you're inspired to somehow join us or join other organizations that do this kind of work, whether it's through data science or other means. Thank you.
Thank you very much, Katie. And maybe some of us will redesign the walkway, the moving belt, because it doesn't always have to go in one direction, and it doesn't have to be just one. There could be many at different speeds. Thank you for that anecdote. You presented a lot of information here, and I'm sure there are already some questions. Before we get to the questions, I wanted to take this opportunity to thank Brianna Aldrich and Nina Rafio, and they really did a wonderful job helping us prepare for this colloquium today. So thank you and kudos to them. There will be many more to come. Marianne asked a question that's quite relevant to your the next project you mentioned on social determinants of justice, I think is what you called it. She said, how did or does crime, for example, and self-inflicted injury play into the social development index, if I read that correctly, into the life expectancy, for example. And then, so that's one question. You can take that first. And let me just invite others who want to ask their question in person. You can raise your hand. I hope we get to all of them. So why don't we start with Marianne's question about crime, self-inflicted injury, into life expectancy and the social progress index. I thought it was in there, but let's hear from you.
Yeah. It is. We have a personal safety, so we measure traffic injuries as well as crime, violent crime, and property crime. And we have taken a look at various different crime metrics to determine which one was, more of a driver of that category. So it is a component because, as we know, if you live in a crime-ridden area, or an area that's just basically unsafe, you are not afforded the opportunities to be outside, right? And when we were all sort of isolating for COVID, many people had the luxury of having a backyard. And if you didn't have a backyard and you lived in an unsafe area, you wouldn't have been able to go into public spaces and be able to have the ability to be outside. So it's a function of all of those things. And it's very important for us to investigate it further to understand what kind of correlation exists.
Thank you. Margot is asking about whether OC health officials use census tract level data when they decided on equitable distribution of vaccines. I believe your work, well, go ahead.
Yeah, they did. And in fact, one of the things that made our work more compelling for them, because the state also released a healthy places index as well. And even though they had information at the census tract level, they identified zip codes as being equity zip codes. And so as we saw on some of those city maps, you can see that within a zip code even, right, there'll be neighborhoods right next to each other that are more or less vulnerable to COVID. And so we had to really drill down to the neighborhood level to be able to get that kind of resolution. And so, yes, the healthcare agency recognized the need for that and used our tool to be able to determine that and achieve vaccine equity. That is, sort of a conversation. I'd like to also bring up the fact that, did we achieve 100% vaccine equity in that effort? I think the effort really built in a lot of this equity parameters, but there's the issue of hesitancy. There's an issue of, being able to fight misinformation on, vaccines and other things that also play a part into whether or not vaccines got into those populations as well. So I would say that in our partnership with the healthcare agency, equity was foremost a concern for them, and they tried their very, very best to get everyone to be able to get equal access, and also the vulnerable populations to get priority access to the vaccines.
Thank you. I saw that Professor Dara Socking is in the audience. She directs the community engagement for the Institute for Clinical and Translational Science. where I also direct the workforce development. And there was a question from an anonymous attendee about the role of your work in guiding workforce development. It's interesting that the vaccine delivery, it's really about mobile, right? So where we have inequitable distribution of workforce or infrastructure, clinics, and then we may be exacerbating the equity issues because it's a touch and go, right? We don't have people working in the community to deliver healthcare. But again, your work is to highlight with data, but you're also following up with where action has been taken. So maybe you can comment on workforce equity and infrastructure equity. Thank you.
Yeah, I think that's a very important conversation to have. And when we looked at the relationship between the communities that have high social progress and versus the ones that had low social progress, you'll see that it's a lot of economic indicators. And the social progress index itself is exclusive of economic indicators, because we wanted to make the point that there are social and environmental factors at play, and we didn't want to muddy the conversation with economic factors. But economic factors is a manifestation of those things, those social conditions, right? So workforce development is a pivotal question, because if we want to be able to build stronger communities, we have to invest in livable wages for the people that live in those communities. I mentioned earlier that not our first responders, but our frontline workers were in a lot of those communities, and they didn't have the reprieve of being able to work from home like others have. And so having those types of jobs create vulnerability for them for infectious diseases like COVID. So definitely something that we are going to explore. We have in fact started talking about building an equity-oriented workforce housing task force that looks into, for one, automation and how that will change the workforce here in Orange County, and which communities are subject to more of the risk around automation. And so I would love to entertain a conversation, a deeper dive conversation with anyone who is interested in that area.
We will certainly try to facilitate that conversation. Thank you. One more question, perhaps. This is such a groundbreaking work for Orange County, and I'm sure it's the envy of other communities. As you said, it's a global phenomenon. People are using this in Australia. It's about sustaining this effort. There is a question, I think, from Mario. What does it cost to first build this? And then going forward, it can quickly become stale if it's not updated regularly, and that's something that you're working on. So can you give us a sense, maybe not exact dollar amounts, but what kind of effort, resources does it take to get this off the ground and to keep going so that it remains useful?
Yeah, the initial building of the index and the infrastructure necessary to do that cost us, and this is public knowledge, so I'm able to share it. It cost us $385,000 to do, and that is the initial construction of it, right? So getting all the pieces place, and that's often the most expensive part of it, and most complicated part of it. Going forward, we think that to sustain it will be much, much less, maybe a third of the cost to sustain it. And again, it's manpower, it's being able to access and compute the index on a continuous basis. And we have received grants and other funding to allow us to do that on a going forward basis. And because of the high research value in our data, we're also able to get support through our partnerships with other research institutions like UCI and others who have a particular interest in working with us. And so they're able to, of course, help us sustain our efforts here as a nonprofit.
Thank you. Madison, maybe Madison will get the last question, which is something that I'm also kind of involved with. Orange County Healthcare Agency got a grant from CDC and relaunching what is now called a Equity in OC. And Madison is asking if you could elaborate more on your current project with CHOC. But I think, if I remember correctly, CHOC has a representative on the steering committee of the Equity OC, but I may be wrong. But anyway, there's questions about CHOC, and you could talk about both in the minute or so we have left. Thank you.
Yeah, thank you for the question. We're very excited about a partnership with CHOC because a lot of the data that we have had and we've started to work with is for the adult population. And so it's trickier and harder to get pediatric data in that sense, right? And so anything that we would do in terms of standardizing a methodology for that is groundbreaking in and of itself, which is why I think the American Academy of Pediatrics is very excited about being able to incorporate some of this. So that is TBD. I'll come back maybe another time and report on that progress. But the Equity in OC initiative, we are one of the 5 consultants. I say we're a consultant, but we're a nonprofit organization offering consulting services, and we are the data provider for that. And Equity in OC is a community-led initiative that will tackle health disparities in Orange County. It's a 2-year grant from the CDC, particularly focusing on disparities as a result of COVID. And as you can see from our work, we understand that data. We're one of the few organizations that have that data. And we're also going to shed light on 6 different population collectives that have been historically impacted by health inequity. And we're going to be compiling various different population profiles on those groups and work with community members and also community-based organizations to be able to provide that data and those insights into those trends and what we can do about it. Ultimately, at the end of the Equity in OC initiative are implementation grants in which the community, whether you are a standalone individual with other neighbors wanting to pitch an idea to the county about a public intervention, or if you represent an organization or a research institution or a collaboration of any of the above, you can pitch an idea for public intervention and get that idea funded. And so it's a fantastic, exciting initiative that's taking place here in Orange County. And it is a derivative of the work that we were doing with the county through the equity map.
Congratulations. Thank you so much. If you could see all the chat comments, intriguing, excellent, exciting, really applause for your work. We don't have the clap hands on the buttons, but this has been wonderful. We hope to have you back in person when all of this clears up, and we would engage more. A lot of students who want to conduct research on equity in our community or elsewhere, this is such a good foundation in data science that you presented. And I look forward to learning more as you make progress toward this really exciting initiative. So thank you very much for sharing your knowledge and wisdom with us.
Thank you. Thank you for the opportunity. And for the warm UCI welcome.
Thank you so much.
All right.
Take care, everyone. Yeah, be safe. We're still in the middle of the pandemic, more or less. Thank you, everyone.